Hello, my name is Dr. Isabelle Benard and I'm one of the GPs working at the Medical Chambers Kensington. I've been working as a general practitioner in London for the past 13 years. Today I thought I would speak to you about childhood obesity. It is now a known fact that 30% of children in the UK are either considered overweight or obese. And unfortunately it's a trend that is increasing. It has almost become the norm for us, and we do find that a lot of parents aren't actually aware that their child has a weight issue. What I would advise is, if you have any concerns or doubts, please bring your child to see the doctor so that they can be measured and weighed accordingly. We know that being overweight or obese in childhood leads to health problems later on in adult life, such as type 2 diabetes, high blood pressure, cardiovascular problems such as heart attacks and strokes. So it is very important to try and keep a healthy weight in childhood and then in adulthood as well. Eating habits and lifestyle are things that need to be taught to our children early on in life. And today I thought I'd give you a few tips on how to achieve this. First of all, I think it's important to remember that children need to move. They need to be physically active more than adults do. And in general rule, they need an hour of physical exercise every day. So please encourage your child to use his bicycle, to walk to school, and to do any physical activity he likes on a regular basis. And we do find that nowadays our children spend a lot of time on electronic devices, which is very sedentary. So we need to encourage them to leave the house and move. The second thing, which is very important, is to teach them how to drink water. We find a lot of children constantly drink water with added squash in them or any other juices that are watered down. It's actually very important to drink water. There are hidden sugars in a lot of drinks that we give to children, and that will lead to them having problems with their weight. Try to be very careful with snacks as well, and go for snacks that are low in fat and sugar. It is important to have regular meals, and breakfast is one of the most important meals in the day. So please try and sit down with your child and have a good breakfast in the morning. It is also important that your child gets to eat with you, maybe sitting down. We do know that children who eat with their parents tend to have less weight problems overall. Now remember that your child is a young person and probably needs smaller portion sizes than you do. And sometimes using smaller plates might help to do that. We all know that home cooking is probably much better than anything that you can buy. And also it allows you to control the ingredients that go into the food. And you'll probably be using less sugar, salt and fat than anything you can buy in supermarkets. We do know that about 5 portions of fruit and vegetables every single day is what you should be having. And your child needs to try and eat these fruits and vegetables early on in life. And we find that sometimes children need to try a food up to 10 times before they actually enjoy it. So please never give up and always try to new foods for them as well, because variety is very important. We also know that fruits and vegetables, particularly fruits, are better eaten whole than juiced or in smoothies, where you get a lot more sugar in the contents. So please just encourage your children to have pieces of fruits, and they will get used to that very easily. So these are the tips for today, and I hope they are helpful. Just remember that keeping a healthy weight in life will be very good for your health and your children's health in the future. Many thanks for watching.